Okay, folks. I'm Rob Pack. I'm a professor of community behavioral health and associate dean for academic affairs. And normally I introduce a speaker. Today it happens to be me and Paula Masters, my colleague, who is the director of the Public Health Training Center, LifePath. Most of you, I think most everybody in the room should know us. Just a little bit of background. We're going to be talking about public health workforce development efforts in Tennessee. We're talking about the center. We're talking about some stuff that we did historically. I must confess, though, that I don't come out of the public health workforce. I have been a public health academic my whole career, and I'm delighted to be co-presenting with Paula, who does come out of the workforce, and we were fortunate to be able to recruit her to run the training center. Because of that background and because of her experience in some of our programs, which I'll articulate in a few minutes. Public health workforce is vitally important, and we're glad to be able to speak with you today about it. So without further ado, I guess I'll go ahead and get started. The way this is going to work is I'll speak for a little while, and then Paula will provide some detail. And then I'll come back up and sort of wrap up with her at the end. Okay, so something I want to, it's kind of a theme here. I want to demonstrate the need to be talking about the workforce, okay? For academics to be talking about the workforce. We're a college public health, we're the public health academics, the academy we'll call it, okay? The university setting. And the workforce, we'll discuss in just a moment. We're going to talk about the need and the need to shrink the gap and our obligation to shrink this gap between practice and the academy. Okay? And we'll talk about our relative position and strength to do that. Okay, so there's a tremendous need for training of our public health workforce. But who is it? Does anybody have any idea, any definitions of the public health workforce?
Health department.
Health department. That's one. That's one. Any others? Is there a definition? There is a definition. All right, there's a simple definition. This isn't it. This is a schematic I found. I did an image search for the public health workforce, and this came up. Okay, and this is one of these flow diagrams that's pretty elaborate. You start there, and you finish down there, and but it's fairly complicated. All right, unless you try to put the right kind of net around it. How about these guys? Are they in the public health workforce? What's going on here? This is in a theater, right? This is a makeshift treatment place. Something's going on where they're treating folks. These are clinical care providers. This looks like an emergency situation, or at least a mock situation like that. Yeah, they're in the workforce. We sort of know that, right? How about these guys? They in the workforce? Yeah, they are. I hope they're well trained too, because they're carrying something pretty serious in that container right there. How about these guys? They in the workforce? Yeah, they may be. In fact, I think they probably are. They're probably strategizing about some sort of health promotion program. So the public health workforce is, at least one definition that I got, they're individuals responsible for providing one or more of the 10 essential public health services. All right, there's a second quiz point. 10 essential public health services. Anybody? All right. Kristen Minnick comes out of the public health workforce. And go ahead.
We used to, I've got my mouth full.
Oh, sorry.
Inform and educate as a public health educator.
Uh-huh. That's right. It's one of them. This is a little schematic that you can find out there. One of the essential services is to monitor health, to diagnose and investigate, right? To inform and educate and empower, right? To mobilize community partnerships, to develop policies, enforce laws, link to and provide care, assure competent workforce, reflexively, and then evaluate, all in this this dynamic system. So that's the public health workforce. So the public health workforce are people that are responsible for one or more of those 10 essential public health services. Huge workforce, and in the nation. If we're doing things right, if they are doing things right, because academics aren't necessarily in the public health workforce, except for the fact that they assure a competent workforce right there. Okay, but if they're doing things right, then we don't hear about them. The public health workforce, if we're preventing disease spread, then public health is working. Okay, so a little bit about the workforce in Tennessee. There's over 107,000 state health department workers in the U.S. Okay, in Tennessee, about 60% of our 5,000 or so workforce are nurses or clerical and administrative workers. There's a whole bunch of vacancies in agencies across the country because of the recession, right? It hit states very hard, and actually during the recession, only about 15% of the vacancies that were open at the time were filled. However, our state is hiring again. That's great news for our students who are going out into the workforce. Staff and faculty, you probably don't need to know this though, because we don't want you looking around. But anyway, by 2014, it's expected that 27% of the workforce is anticipated to be a retirement age. Of course, a lot of folks had their funds in 401ks and so on that took a dive in the recession, and that kept many from retirement. So people were holding in place, and states were shrinking the budgets. The Association of Schools of Public Health and the Institute of Medicine say that by 2020, more than 250,000 new public health workers are going to be needed. However, and I will say this about the historical workforce that's moving out, relatively few have any formal training in public health. And that's where we come in, right? The existing and emerging public health workforce, they need accessible quality training on the non-academic and the academic side. Many of them do need academic training. In fact, only 8% of folks in Tennessee in the public health workforce, of that 5,000 that I mentioned, only 8% of them have a master's degree. So, and fewer than half in Central Appalachia have a bachelor's degree. Training was one of the first things to go during the recession, and so folks who are in the seats in public health agencies don't necessarily have opportunities to be trained from the local health department or even the state health department budget. So that's where we come in. The good news, there are willing practice partners everywhere that are interested in creative solutions for training. All right, and we're going to talk about that specifically in a few minutes. Here's one potentially creative solution that Dr. Martin wrote up, that Dr. Wyckoff spearheaded, was an undergraduate certificate. What if we could get people trained that don't have a bachelor's degree? What if we could get them trained in public health? Just a couple of courses so they have some competence. And so we wrote that up. It hasn't been as popular, mostly because the academy university is not quite as responsive to how open they need to be for the workforce needs. So there's a lot of machinery that goes around that that actually creates admissions parameters that folks in the workforce find hard to achieve. So anyway, that's one potentially creative solution. One of the things we're going to talk, I guess I'm going to mention now, is some of our efforts in shrinking the gap. Okay, we don't exist without the practice community, and so I'm going to talk about some strategies that we've used, some that we're using now, and some that we're going to use in the future. So one of the things that was going on when I first came here in 2008, it had been going on for a couple of years, was a workforce development consortium between four academic partners: ETSU, UTK, UT Health Sciences, and the Tennessee Department of Health. TDH funded the consortium for a couple of years with some real money, and they funded it to the Health Science Center at UT, who managed the consortium, and what it did was it was an articulated pathway from graduate certificates to the MPH and through to the MPH, okay? Paula Masters got her graduate certificate while she was in the workforce, had it paid for, right? Got a graduate certificate in healthcare management, right? And then transferred all those credits into the MPH and then graduated through the WDC, the consortium, all the way through the MPH. And graduated in 2009? Mm-hmm. Yeah. All told, there were 74 graduate certificates, we think. The accounting of these things is actually fairly difficult. We didn't award all of them. And 22 MPHs through 2012, we think. And these were all state health department employees. This was a creative solution, and it was a really good idea. It had some complications. There was actually a fair amount of complexity to this. We, to get people into the program, for example, we didn't require the GRE. Some folks for whom we did not require the GRE failed to thrive in the MPH program. Weren't really ready for graduate training, and so that was an issue. We discovered that we needed frequent and accurate communication, more of this, and so we decided that a concierge level advisor was needed for that group. Okay, for somebody who could stay on message with them consistently. And these inter-university consortium arrangements are really complicated. And when you're trying to say, okay, this counts for that, and between universities, this gets really, really complicated. So we know that it was a good idea with good outcomes, but it had a lot of moving parts. And so we had to learn from that for our our new strategies, which we're going to talk about in a couple of minutes. But here's why we know it was a good idea. All told, from our college, through the Workforce Development Consortium and currently in LifePath and in our online programs, in our state, these are folks who are out there across our state. Okay, so these are our students rather, or graduates. For purposes of comparison, 75% of university or ETSU students come from this 15-county region right here. Okay, typically. So we have a much greater geographic reach than that, and in fact all the way across the nation with our online program. So we know this is important. We know that people are accessing it. It's a good thing to do. It comes with some complexities, but hey, the complexities are worth it. So when we had an opportunity to apply for training center funding from HRSA in 2009, it's 2010 actually, wasn't it? So in May 2010, a few of us got together and drafted the Public Health Training Center proposal. Dr. Wyckoff, Dr. Corey, and a few others were instrumental in helping to draft that. And what we did was we said, well, let's learn from our Workforce Development Consortium experiences. Let's put together a plan for a Public Health Training Center here in Tennessee, and let's respond to this RFA. So we did. And we were awarded funds. Okay, so right here we're going to take a little bit of a turn. I'm going to tell you a little sideline. Can everybody see this thing right here? This tiny little LifePath symbol? Can you see the one down at the bottom beside the red arrow? Hidden in the grass, all right, through the end of this presentation is are some more of those. Okay. So at the end of this talk, there'll be a quiz, and the first person who can accurately tell me how many of those were hidden in the grass will get a door prize. All right?
Now they're all paying attention.
Yeah. All right. Door prize.
Does that count as one?
I told you that question.
Thank you. Yeah. And Paula warned me. She said they're going to ask, does that one count? That one doesn't count. That one doesn't count. They have to be this size. Okay? This size, but that one doesn't count. All right. Neither does the one at the end that's sitting next to another red arrow like this. All right. Okay. All right. Okay. So just a quick detail. I'm going to turn this over to Paula. So what is the Life Path Training Center? Well, it turns out Hearst is really interested in this topic too, as you might imagine. And so they put money into funding 37 of these public health training centers nationwide. There's the map. You can see. We're that one right there. Okay? This is a 5-year award. It's renewable. After 5 years, it's renewable for another 5 and so on. Right? We're real pleased about that. And it comes with real resources. Okay? These are resources we get to put into training the public health workforce. So we're really excited about that. We're statewide in Tennessee. This is our primary service area. We also said we would cover some of Southwest Virginia, although their access to some of our programs is a little more constrained because of the personnel HR rules at the state health department level. And all of our training programs are done all the academic training is done online in the program. Okay, so this has been going now for 2.5 years, right? 2.5 years, and so in probably a year or so we'll write a competitive renewal, and we'll try to get it refunded. So that's an overview of the center, and I'm delighted to turn it over to Paula, who, as I mentioned, we were able to recruit from the workforce to run this program to train the workforce. So. Paul?
Okay, so my job in this presentation is to paint the big picture of exactly what it looks like that we've been able to accomplish through LifePath for workforce development in Tennessee. And just a side note to what Dr. Pack was talking about, the initial proposal included Southwest Virginia. At the same time, though, Virginia itself was applying for a PHTC and got it. So it didn't make sense for us to compete for them in their own territory. So that's why even though we offer things, because obviously we're located in a regional university in which includes that geographic location, at the same time most of our efforts are on Tennessee. This is what it looked like for the academic program. So this is not new to any of you. You know that these exist. You may not have known that how many in here actually knew that we had an undergraduate certificate? More than I thought. After this, I expect all hands to be raised, that you guys know that. So it's 5 courses. It's Public Health Fundamentals for Field Professionals. And it includes core competency areas for undergraduate training with the exception of biostatistics. And what we found was, what they found when they were planning this is that if you're going to plan something for the workforce, you need to hear from the workforce of what they need. Yes, you guys, all of us here, we know best practices. We have the competencies laid down. But if you build a product without their input, they may not care anything about it. And so they really listen to the workforce. And so instead of biostatistics, actually emerging technology for healthcare professionals was put into that instead, because that's what they kept hearing that they wanted to see. So it's a 5-course sequence. Graduate certificates, 15 to 18 hours. So healthcare management is a 6-course, where epidemiology is a 5-course. MPH, epidemiology, health services, admin, and community health. Is Marianne? Yay! So we're going to be able to offer community health online. Awesome. And that's one of actually the largest requests we get is community health.
It's 30-day review at TBR, I believe.
Yeah. Wonderful. And then DRPH, and it's not online. Standard admission criteria. So I just wanted to give you what this currently looks like, those that have come in and are LifePath students for this. So currently we have 19 students. And interestingly about that is that, so the first time when Dr. Pack asked you, who's the public health workforce, the first one that everyone thinks about is health department. 50% of our LifePath students are non-public health governmental employees. 50%. So when you think about public health workforce in Tennessee, it's not just governmental. So there's public health everywhere, and it shows so in 50% of ours. We have 4 people currently in the undergraduate certificate. We have 7 graduate certificate, 3 in EPI and 4 in healthcare management. And we have 8 masters of public health, 3 in EPI and 5 in health services administration. We have graduated 4 LifePath students, and 2 of those were actually governmental, so it's still still going to where we have 50% governmental, 50% not governmental. And then we have 3 that are going to be coming up and graduating this spring. So it's been very successful. Just a little side note, I've been in West Tennessee for the past 2 days, and it's amazing the feedback and overwhelming response when they find out how much stuff we have online. That even though the University of Memphis is in their back door, when they found out, they did not realize how much we had online. And when I showed them, feverish writing started happening and talking about admissions process. So it was really, really good. So that's what it looks like currently for our academic programs through LifePath. They get a stipend. So a lot of people think that LifePath is a course, a tuition reimbursement. It's not. They actually get a cost of living stipend to help offset the cost of going back to school. Because what's the number one thing that usually happens, the reason that people don't go back to school? Money. Absolutely, it's the money, and especially if you're a workforce person, especially if you're a public health workforce person, because what happens in public health a lot of times, you may love your job, but do you get paid a lot? No. Unless you're me, and of course I was making all kinds of money before I came here. So students who qualify, they receive a stipend. Those stipends look differently depending upon what program. So undergraduate is different than graduate certificate, which is different than actually the master's online. Okay, I've already said that. So Tennessee Department of Health employees, this is one thing that is a little bit different. So TDH employees, there are 3 different types of employees. So there are state, there are county, and there are city. Not all of those employees, even though they carry out the same job function, get an educational waiver. This is a huge problem. So what we do is we help identify those that get to use that and help facilitate that process to make sure that they're getting the most bang for their buck. They can't receive any other federal help. Since we're federally funded and we're giving them federal money, they can't receive any other federal. They can receive other state, they can receive loans. They just can't receive any other federal grant money. That's academic. Non-academic is a different story. Non-academic is a little bit harder, I think, sometimes for us to wrap our minds around when we're so used to only thinking about academics. So the way that our non-academic training works is it is a complete multi-pronged approach. It is competency-based. It's in direct need, either by request or what we found in our needs assessment. It's through seminars, workshops, conferences. We bought a learning management system in which we offer content very similar to D2L, just a little bit different. And then we offer continuing education, because the other thing that we heard is that in the public health realm, there's not a lot of opportunity for CEUs. No matter if it's CNE, CME, social work, chess, it doesn't matter. They don't have a lot of opportunity for CE. And then sponsorships. Sponsoring training that already exists to make sure that more people get to take part in it. That's the other thing that we do. This is what our learning management system looks like. This is just the interface of it. This is where they go through. Obviously, you have to register to go online, so that way we can see who the learner is. So obviously, I'm giving you guys numbers, so I just wanted to let you know. So through our non-academic training, even though the grant started in September of 2010, staff was not here until January 2011, and we didn't launch our first program until April 2011. So in that first year, which actually turned out to be 4 months instead of 12 months of training, we trained 477 people. In year 2, we trained 2,596 people through non-academic training. And already into year 3, we've trained almost 1,300. So we've trained over 4,300 people in non-academic training in the state of Tennessee. That's huge. When I communicated that to HRSA, they couldn't believe it. Especially when they found out that our learning management system is the minority when it comes to provision of the training. In other centers, there's 37 centers across the nation. All of the other centers, they handle everything almost primarily, online. So when you look at it, it's about 5 to 10% of their offerings are in person. 90% of theirs is online. Ours is the reverse. So we actually pounded the pavement enough to cross the state of Tennessee to train almost 2,600 people this past year. So that is a feather in all of your all's caps, the fact that we represent you guys in doing that. This is the training catalog, and I've done actually a disservice in the fact that I have not even recognized other LifePath people. So Dara, Kristen, and Shirley, stand up. And now dance. No, I'm just kidding. Okay. So this is your LifePath Training Center staff. Kristen and Dara are newer to us. Shirley, she's been with me and helps me all the time. Dara is data and evaluation specialist. Kristen is our new coordinator, or what you saw up there, concierge. Dara is the one who came up with this training catalog, and it is phenomenal. It was direct request that we wanted to put something together that we could just have everything on paper or electronic that we could send out, and this is our product. This is who we are. This is what we do. Yes.
I also want to recognize Sean Boyle.
He's not here.
A whole lot of our, I know Sean's not here today, but a whole lot of our logos, graphics, the logo, a lot, just the way it looks, the brand, if you will, came out of his Mac.
Yeah, out of his. That's absolutely right. Okay, so this is the training catalog. This is hot off the press, and so we haven't even sent this out yet. It's going to be going out to the masses next week, so you guys get to see this. Okay, so it's going to be available both electronic and in print, but this outlines exactly what we are, and the reason I want to show you this is to show you exactly what we have when it comes to web-based modules. But this will go to you guys too. The other things that are in here I haven't gotten to them yet to talk to you about. But you can see how user-friendly this is. All of these links go to our website for training. They are direct links, so that way someone can go in, they can click on this inside, and they can go straight to registration. So here's some of our learning modules that have been developed by you guys, by faculty here. So we have Health Services Administration. It's a 9-hour content developed by Mr. Tim Baylor. Human Resource Management, also developed by Mr. Tim Baylor. All of these are put through the lens of practice competencies. So when they are reviewed for content, it's for relevancy and competency based, and they include learning objectives, so that way anyone who's going through, they can see exactly what they're going to be getting from this. Information resources for public health professionals. This was by Dr. Rick Wallace over in the library, in the medical library. One thing that we still hear now, and we're actually going to follow up from this guy and do statewide training, interactive training of how to get evidence-based public health out to the workforce, because they don't have that resource currently. And this is what we heard. So Dr. Rick Wallace actually developed this, and how to access, how to use PubMed. Why is it relevant? Why do you need to go and look at the evidence? So it was a really, really good one. Quality and process improvement for healthcare professionals. It's 3 modules also. I don't know if you know, but right now Tennessee Department of Health, it is going through a huge QI process. It is going up for the Tennessee Baldrige Award. And in that, it has to go through the performance excellence. And what we all know, obviously, in academia, is that performance excellency is a step towards what? What's really hot button and sexy right now about health departments? Accreditation. Accreditation. QI, performance excellence, that's a step towards that. And they know that. Public health and nutrition, opportunities and challenges. Thank you, Dr. Slauson and Beth O'Connell, for doing this. Successful communication with diverse populations. And then understanding health policy, the United States and Tennessee. Dr. Mahmoudou developed this one for us. In the past month and a half, our online training numbers, what do you say, Dara, have at least doubled. if not more. And it's because we've now had something more like this. This is going to be brand new, but we put it all together and have been going across the state talking about it, and it's more than doubled our online learners. Yes?
Someone from another state access this?
Yes, absolutely. And that's actually, we got, when I was in West Tennessee, these past 2 days. They are. Yeah, sometimes. But that's what they were talking, is because actually in West Tennessee, a lot of their people, even though they're working in Tennessee, they live in Arkansas or Kentucky and Mississippi. And so that's what they said, is it restricted to Tennessee? It doesn't matter where you are, you can access any of our online programs, and we encourage you to. And then we also have all of our lectures. So I'm not gonna keep going through all this, but we have all of our lectures. Anything that's under the LifePath umbrella, we either live stream and record, or at least record and make it available after the fact. So this is all of the lectures that we have. So you guys, I hope that when you go through it, please, let me know of anything that you would like to see or add. And then this is going to be important when we come back in a little while, when Dr. Pat comes up here in a little while and we talk about online development of web modules. Okay, where's my clicker? That was just to make sure you're still paying attention. Again, opportunity for faculty. We're going to talk about that. So here's another thing that's under actually LifePath. I don't know if you know, but so not only are we training for just the state of Tennessee, but we also received another grant from NACCHO to launch the Survive and Thrive Roadmap for New Local Health Officials. It is a 12-state representation, and we are the Southeast Training Center for Survive and Thrive. It was a partnership between LifePath and the Tennessee Institute for Public Health with Miss Jeannie Kidwell. And she and I work on that right now. We actually had a coaches call right before we walked through this door with all of our 6 coaches and 30 fellows across the 12-state region in which we serve. It's a year-long intense training for new local health officials. And it is wonderful. I actually, one of our coaches today who served, I think, in every capacity you could, was talking about how this is really becoming the leadership institute of which everything else is going to be based on when it comes to new local health officials. So it's really good that we're part of this, so that way we can learn from it and then apply this to when we're planning leadership training in Tennessee. These are our partners. So we partner, and we could not accomplish statewide training when Tennessee is 9 hours long if we didn't have partners. And our partners are Meharry Medical College, the University of Memphis, University of Tennessee, Knoxville, obviously the Tennessee Department of Health, Tennessee Public Health Association, which is a huge partner of ours, and then NACCHO. We also do something for workforce that we don't want to forget our students, and we don't want to forget how appropriate it is to make sure that the students are going out and working in and applying their knowledge through field placements, which ETSU knocks out of the park. I cannot tell you how great ETSU is about field placements when I'm talking to everyone else that does my same job across the nation. So what we wanted to do, though, is under LifePath take it a little bit of a step further and encourage the students to do their field placement in a medically underserved area or a health professional shortage area. And the way to do that is to offer finances to make it easier for them to access those communities. And that's what the Field Scholars Program is that it is a financial stipend given to graduate level students who are conducting their field placement that meet the criteria of doing it in an MUA or an HPSA. And it doesn't have to be an ETSU student. It can be at any one of our academic partners, but it is facilitated through us. This is what it looks like. One of the requirements after you agree to take our money is that you have to provide us with a bi-weekly blog. And that is so that way everybody sees exactly what you're doing in that MUA. How are you being of service? And they upload pictures too. And so this is just a snapshot of what that blog looks like. And it allows the current field scholars to have a place where they can talk amongst themselves too. So it's really great. I don't know what that is.
That live pass.
Oh, I was just like, what do you mean what I just said doesn't count? Everybody just subtracted one of their little counters, didn't they? All right, needs assessment. Workforce needs assessment. It is one of the requirements that we must adhere to, because we don't need to sit up here in East Tennessee and think that we know the needs across the state of our workforce. We want to hear what they are. We also want to see what it is when we're thinking about training needs, because it needs to be competency-based. So what are the competency needs to make them a more successful workforce? Just like Dr. Pack was saying, is that 80-ish percent of our workforce does not have formal training in public health. So obviously they need some other opportunity of becoming a more competent workforce. And that's what we need to do. We need to learn from them on how to best approach that. And that slide just sums up what I said. So first year, we did a more informal approach. So we began with frequent informal conversations with partners in workforce. We launched focus groups across the state through our partners and ourselves to learn what their needs were, so that way we could go ahead and get the ball rolling and start offering training. It was definitely a qualitative approach, and we consistently heard management, leadership, budget, and finance. Everywhere we went, this is what we heard. And so we actually planned our first year round of training around those topics. Second year, it was much more, it was a completely different approach. So it was competency-based from the Public Health Foundation. It was based on the 8 practice competencies laid forth by the Council on Linkages Between Academia and Practice. It was a partnership with the Tennessee Department of Health. So it was actually a data use agreement. We went through a contract with them to do this. And we sent out a survey to all employees in the whole Tennessee Department of Health, no matter county, city, or state. It didn't matter. They all received it. It was spearheaded by Dr. Brian Martin, analyzed and supported by Billy Brooks. I was just part to just smile and nod. And then Autumn helped Billy, and Dr. Pack, he is the leader. So he definitely oversaw everything that was going on with this guy. The objectives: survey development, competencies, design, job classifications, that's going to come in key here in just a second, and implementation and results. That doesn't count either. Survey development. So it was first done by the North Carolina Institute for Public Health. They developed it, and it was the first time that a competency-driven by tier assessment had been done. They piloted it in West Virginia, and then we took their survey and we used it with a little bit of difference. It's based on the 8 core public health competencies, and then it is by tier. So one thing that they saw is these competencies came out quite a long while ago, and then they saw that they weren't applicable unless you entered into a tiering system of where they were appropriate by level of position. And so there's entry level as tier 1, management tier 2, and leadership in tier 3. It was an anonymous survey to all TDH employees. We actually were given an email address from the Tennessee Department of Health. That's huge. I don't know if you guys understand why I even say that, but for a state institution to give someone else an email account to use as they wish, that's a huge leap of faith. And so we really were, it was a big step in the right direction for collaboration. Data was maintained by ETSU, cleaned, and then all the clean data went back to TDH, so that way they could also use it in planning training. So the way that we did it a little bit differently than had been done before, beforehand the assessment was sent out to the employees, and they self-tiered where they thought that they fit. So a description was given of tier 1, tier 2, and tier 3, and they self-tiered. We wanted to do it a little bit differently. So we allowed them to self-tier, but that's not what drove what questions they received. What drove the questions that they received where we beforehand, working with Tennessee Department of Health, working with persons that were in all of those tiers to hear the feedback, we took the job classifications for all TDH and we had them tiered. So then that way, when a person was given this, when they clicked whatever position that they held, they were then directed in the correct tier as seen by the Tennessee Department of Health. Then what we did was then we looked to see how connected it was between what they thought they were and what the others thought they were. So it was very interesting to see how someone self-selects in comparison to what their job title may reflect. Delivered the survey through June with 3 reminder emails. There was one issue, and to be transparent, we must talk about that issue, and that we were given a list of job classifications, and it was not comprehensive. So the Tennessee Department of Health gave us about 2/3 of the actual job classifications. So what we did, it was actually a very quick remedy, it worked out well, is that we took the remaining job classifications and those were tiered by the exact same group, and then what we did was then anyone holding this position, we gave them an equivalent. So that way they could still go into a job classification and receive the exact questions that they needed.
So instantly we discovered that while the survey was being done.
Right.
This is after all the pilot testing. While the survey was being done, this came up.
Yes, so the survey went out at 1:02 a.m. and our first call, I think, was at 6:05 in the morning, in which they were just like, I can't find my job. And I happened to be presenting to the executive leadership team in Nashville at 9 that morning. So it was good because between 6 and 9, we already had it done. We were ready to go and answer any questions about job classifications. Response rate, this is what we looked at as our response rate. Number of respondents who selected a job classification and answered at least one of the competency-based questions. Right at 60% was our response rate. The fact that we had that issue going on, that this was the first time that any survey had ever been administered to the entire Tennessee Department of Health, that response rate is phenomenal. It's awesome. And TDH even says that also. They hadn't seen that type of response rate when they've done something this large scale with issues. So, reports went out on the 12th, 21st, 29th, and 30th. There was a presentation that we gave about the results to the executive leadership team of Tennessee Department of Health, so that way they could then go ahead and we could have action items in which we need to talk about methodology and next steps. And then in that meeting, we really started talking about suggested training objectives. What was it going to look like? And now really prompting the Tennessee Department of Health to say, this is your needs, let's move forward, let's work together to go on and work through training. This is your 50,000-foot message from the Workforce Needs Assessment, in that it produced a needs score. So through all tiers, 1, 2, and 3, that of the 8 areas, 8 practice competencies, a need of over 50% was seen in 6 of those. That's huge. That's huge. That means that when it comes to training, that there is a lot of work to be done, and what's great about this is there's a lot of interest to get it done. So there's great need there's great need throughout Tennessee when it comes to training opportunities, especially competency-based. Another approach that we have to help to better serve to reaching those training needs, and also to start really looking at collaboration and what it could look like between practice and academics, is a thing called the Academic Health Department. I'm sure some of you guys, or most of you, have heard about this. It looks different depending upon who's doing it. So its goal is fusion. If you don't take anything else away from this, Academic Health Department is to fuse practice and academia. And so its really goal is to take the 10 essential service areas and blend those with the 8 core competencies of practice. So there was a great document that came out that crosswalked the 10 essential service areas and the 8 core competencies of public health and started looking at those, so that way when you looked at those competency areas in which we found in that needs assessment, when it actually looked like what did it mean for the carrying out of the 10 essential service areas, this is what it looks like. So then training can really be tailored down to that granular level. Other goals: provide long-term projects and guided opportunities for students. It's not just a field placement, more opportunities for application. Provide research and project opportunities for practice and academic collaboration. This is a huge one. To have research that includes practice and academics, and coordination and collaboration, that every time that we do something now that we are all that we include everyone, that it's always collaborative. Statewide, it's a teaching hospital approach. This is what public health's analog is. Formal relationship. University of Tennessee Knoxville already had one with Knox County Health Department. Theirs is a little bit different. And then we launched one in October with Sullivan County Regional Health Department. The whole reason that I was in West Tennessee is because I was securing that we're going statewide with this. So we will be launching 3 more over the next 6 months. We're going to have 2 in West Tennessee, and we're going to be having 1 in the Northeast Regional Health Office. That is how many feet from here?
It's probably 150 yards from here.
150 yards from here that we actually have a regional health office on our campus. All right. AHD in Sullivan County. This is what it looks like, some of the things that have been done. Our academic health department coordinator in Sullivan County right now is Miss Christian Williams. Christian, wave your hand. She's been doing a great job knocking it out of the park. They actually made her the health council facilitator. That's huge. So that way she's in the community all the time. Carrying out the MAP process, the other community assessment process that Tennessee Department of Health is launching. She's started a Grand Round series that she is implementing for evidence-based practice. PALS Leadership Academy, their ELT team, their executive leadership team is going through this. And then mentorship and coordination of MPH and undergraduate students. So any of the students that come through there, she makes sure that they're getting the experience that they need. Another thing that we're doing to blend academia, students, professionals, practice, and leaders is we're starting a series called Building Bridges. And that will be, there's going to be 3. It's going to be East, West, and Middle in Tennessee. All of the academic institutions and all the practice leaders are going to be invited to come in and have an open discussion about need, about training, and how to best serve and streamline students and professionals. And I'm going to turn it over.
Adelina, can you hear me okay? Good, thanks. Okay, so to sum, LifePath is a training center that has resources, right? And the resources go to support these different functions. The academic training, which is part of our portfolio, the non-academic training, which is another large part of our portfolio, continuing education, of course, the needs assessment, which we continue with every year. The one major quantitative assessment we did, we'll probably replicate it in a couple of years, but all throughout time we'll continue with qualitative needs assessment. And of course, we partner with folks across the state, and I can't say enough about this. I mean, this has really been important to us. Working with the State Department of Health. The State Department of Health has been an active and consistent and very important partner with us. So is the Tennessee Public Health Association. Very, very strong partners. So this has been really good, and we've been able to support them with some money for them to get non-academic programs going in their own neck of the woods, and of course the resources. So that's and the resources that are helping us to bridge the academy, if you will, with practice. Okay, so this is the last thing. Okay, last couple of slides here. We as a faculty, staff, and students in the College of Public Health, we're uniquely positioned to facilitate bridging this gap. All right, we have size, right? We have scope, knowledge. This is in our own interest. Okay, and we're training our own workforce right here. Our college has prominence. It's increasing every day. Every time we get a great lecture like we did last night, or every time we get in the press, this helps us because we're in the news, and we're beginning to get the inertia, right, that really can lead to great impact. So we have this this scope here. And we in our programs, right? So the activities that we provide: impact evaluability, evidence basis, management skill, quality improvement, research potential, right? So we get to go out to practice and say, hey, how can we learn from you guys about your assets so we can begin to brainstorm some research concepts together? Folks in the practice community are willing partners, and they're willing to get into these relationships, and there's a lot of goodwill here right now. We just got to reach out, okay, because it's on us. We have the capital and credentials, the inertia. We have the capacity, okay? So we presented the need. We can shrink the gap. We have the position, all right? So what do we need from you guys? Well, we need web modules, okay, and we'll pay you for them. We have real money. For 3 credit hour content, I don't mean 3 credit hours like a class, okay? This isn't like adjunct. This is development of web modules. We'll pay for 3 credit hour content, or 3 hours of content, pay $1,000 to get it developed, all right? Then we put it on the LMS. We need evidence-based public health lectures that we can record like this. We can do some or not like this perhaps, but like a Leading Voices style lecture where we've got some CME credit and so on. Talk to us, and we'll help you connect with key players to develop research ideas. You know, what if we expanded our scope of thinking about our laboratory to the state, right? What if we start thinking about our connection to the state public health labs, for example? What if we went well outside the walls of the university to grow our research capacity with our practice players? So just reach out to us, and we'll connect you with the right people if we can. Okay? And we need you to mentor students in applying their skills out in the community. And of course, we also need your participation in the Building Bridges work. All right. So with that, we're gonna entertain questions, and we greatly appreciate your time. This is a great effort by a team of folks led by Paula, and I'm delighted to be associated with it. The other thing I did not mention was the co-investigators on the LifePath grant, including Randy and Karen and Brian and others. I don't think I missed anybody. Did I miss anybody? Yeah, and it's a great group to work with, and we're excited to have this center at the college. So if we can, we'll answer any questions for you. Okay, I got a question for you guys. First person to raise their hand with the accurate number of tiny little LifePath logos in the grass. Michelle raised her hand first.
6.
6 is right. Michelle gets a sweatshirt. Yeah. Yeah. Well done. Hey, folks, thank you so much for your time. We really appreciate it.